acaban. Falta mucho para pensar, cambiar y analizar. Tenemos que resistir cuando tratan de silenciar. Nuestra voz está, la unión está la llave para luchar. Grítalo fuerte si te quieren silenciar. Grítalo fuerte, la injusticia va a temblar. Grítalo fuerte que el mundo se va a acabar. El mundo dominado por la desigualdad. Somos los mensajeros por montón, vamos creciendo, repartiendo sentimientos, promoviendo el movimiento. Somos los mensajeros por montón, vamos creciendo, repartiendo sentimientos, promoviendo el movimiento. Que se acabe el silencio, que si con corazón gritamos, nuestro eco se escuchará en los rincones más lejanos. Que se acabe el silencio, que si con corazón gritamos, nuestro eco se escuchará en los rincones más lejanos. En América Latina pedimos tierra ancestral. En África la gente pide su tierra ancestral. El pueblo palestino pide su tierra ancestral. En Toronto y en Nueva York los pobres mueren sin hogar. Escuchen bien lo que quiero comunicar. Dueños de todo son pocos y eso está mal. De la única forma que todo esto va a cambiar es si acabamos el silencio, vamos todos a gritar. Somos los mensajeros por montón, vamos creciendo, repartiendo sentimiento, promoviendo el movimiento. Somos los mensajeros por montón, vamos creciendo, repartiendo sentimiento, promoviendo el movimiento. Que se acabe el silencio, que si con corazón gritamos, nuestro eco se escuchará en los rincones más lejanos. Que se acabe el silencio, que si con corazón gritamos, nuestro eco se escuchará en los rincones más lejanos. Que se acabe el silencio, que se acabe el silencio, que se acabe el silencio, que se acabe el silencio.
Hello, everybody, and welcome to the launch of Communities Are Partners, Workers' Occupational Health and Safety Rights with Newcomers by Dorothy Wigmore in partnership with the MFL's Occupational Health Centre. Thank you all for joining us at this Zoom webinar presentation. I just imagine all of you out there. We had over 40 people registered for tonight. So thank you so much for spending your evening with us on this very exciting day of the launch of this report. We're broadcasting tonight from Treaty 1 territory, the original lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene people, and the homeland of the Métis Nation. And health and safety is important for all of us on these lands. And particularly, it's important that newcomers to Winnipeg and Manitoba learn about occupational health, safety rights, and the right to refuse unsafe work and compensation rights. And that's just what the Occupational Health Centre has been doing for the past 20 years. And so this is also a celebration because it's the 20th anniversary of this program. So it's so wonderful that we can have this report documenting the history of the program and its accomplishments over the past 20 years. My name is Molly McCracken. I'm the Manitoba Director at the Canadian Centre for Policy Alternatives Manitoba office. And we are the publisher of this report. And I'm pleased to acknowledge funding for this research from the Manitoba Research Alliance Partnership Grant, Partnering for Change, Solutions to Indigenous and Inner City Poverty, thanks to the Social Sciences and Humanities Research Council. I also want to thank the Manitoba Association of Newcomer Serving Organizations for co-hosting this with us and helping us get the word out on this event tonight. Thank you so much, MANSO, for stepping up to support us here tonight. So I'm your host here tonight. I'll just go over our agenda. First, we're going to hear from the Occupational Health Centre from two community trainers, Marta Chicas and Arek, and then also from Carol Hamilton about the history of the program. And then Dorothy Wigmore will present the research, and we'll have time for questions at the end. So just a note about the questions, you have a chat on the left-hand side of your screen. You can put questions in the chat at any time or comments. It's nice to have that as a way to share information. And we'll be taking questions from the chat. Also, we're going to try taking questions from you. If you wish to ask your question over the computer, you can raise your hand. There's a function for that. Or you can also just put an asterisk there and we'll call on you. It's our first time doing that, asking questions verbally on this platform, but we thought we'd give it a try. So we could do that at the end when it's time for questions. So yeah, that's the kickoff here. So it's my pleasure to introduce Marta Chicas, who is the community liaison and on board member of the Occupational Health Centre. So over to you, Marta.
Thank you. Thank you, Molly, and thank you everyone for being here with us, spending the time, and for giving us this opportunity to share with you this outstanding work that we had been developed throughout the years. Yeah, so it's my pleasure to introduce the Occupational Health Centre, the Communities Are Partners report. So just to give you a little bit of background of Occupational Health Centre is a great agency that we're going to resume in a couple of slides. So the Occupational Health Centre is a community health center focused on workers' health. They provide medical services for workers who have related health issues related to work, and provides education, training, development of informational resources, materials on worker health, safety for workers and communities. It was established by the labor movement in the 1980, and it is governed by a board of directors made of representatives of many Manitoba unions, as well as 3 community representatives. So it is funded by the Winnipeg Regional Health Authority for all workers in Manitoba. Programs with newcomers, migrants funded by Immigration, Refugees, Citizenship Canada, Workers' Compensation Board of Manitoba, Research and Workplace Innovation Programs. So yeah, today we're celebrating the 20 years of anniversary, and this work is started with a needs assessment. Needs assessment was conducted in 1999 with newcomers, migrants, about their needs for workplace health and safety education. So through this program, the Train the Trainer has been provided to many communities in different language. So they cover basic occupational health safety workers, compensation rights in Manitoba in first language. So it's recommended a Train the Training, that needs assessment with members of communities, newcomer communities, providing workshops in their own languages. So it is following the community development approach by Labonte, which says that the process of organizing in or supporting community groups in identifying their health issues, planning and acting upon their strategies of social action, social change, and gaining increased self-reliance and decision-making power as a result of their activities. So the community development approach process follows the help people to develop skills that they need, removes the structural barriers that prevent people from achieving their full potential as community members. And through this work, sometimes this work is done in the kitchen tables, very informal conversations with community members, church basements, or even community centers. It is adapted according to the needs of the community. So in this way, we'll remove the structural change barriers that are, available in many organizations or that are provided in many organizations. It also involves a transfer of control from one group to another. So the cross-cultural community advisory committee is composed between 6, 7, and 9 leaders and service providers from a variety of newcomer communities, and oversees the Occupational Health Center work with newcomers, provides direction, guidance, makes policy and programming recommendations. So this is a picture of these beautiful people, as you can see, different communities from different organizations, different languages, and it changes sometimes according to the needs of the community. So the Occupational Health Center understands that communities are partners. This was one of the quotes from one of the trainers. So that's what it follows this event. So there's cross-cultural community advisory committee member trainer. So, and I will let Karen continue with this conversation.
Hi, everybody. Thanks so much for being with us here tonight. And thanks, Marta and Molly. I'm going to just share a little bit about what actually we do in the program and what our work looks like. So we do have a Train the Trainer program, which is a 10-week training program on workplace health and safety issues. And so members of newcomer communities come to this Train the Trainer program and learn about kind of an introduction to all these areas that are up here on this slide. Oops. And here's a group of folks who came through our Train the Trainer program. And that was from a number of years ago now, but it's a favorite photo. They then go on to provide community workshops on workers' health and safety. So these workshops are delivered by our community trainers. They focus on covering the workers in Manitoba have 4 health and safety rights. So the workshops focus on that, as well as community resources, including workers' compensation and what workers should do if they're injured at work. These workshops all happen in community's own language, and they take place in community settings outside of the workplace, where we find a lot of newcomer and migrant workers are more comfortable to participate and ask questions more openly. The trainers receive an hourly rate of pay for a maximum of 10 hours per workshop. So this isn't really just a volunteer work. We do acknowledge and recognize the labor of the community trainers who are contributing to our work. So we have all of these participating communities in our program at this time. And it's kind of neat that I think this is the 20th year, and I believe this adds up to 20 communities that we've got now that we're working with. We started with just 2 in 2000, and we've grown, so that I think that feels like 1 a year. So here we go. Here's a picture of one of the workshops that took place in the community, and this is in Aguadora. And I believe Monica, the community trainer, is here with us today in the audience. And I love this picture so much because one of the reasons I love it is because think when I first started 20 years ago, workers' health and safety was really kind of seen as a male-dominated kind of field. We always talked about like construction safety, and so there was a bit of a stereotype about it not being as important to women. So I always love seeing groups of women both teaching and learning around their workers' rights, because we know women make up a big part of who Manitoba workers are. So as we learned and gained experience and built relationships over the years, we developed a number of different new work areas while still maintaining that core Train the Trainer program. So we have offered a Train the Trainer program specifically with hog processing workers from 5 cultural communities in the Westman region. We've offered more in-depth occupational health support groups for both poultry processing workers from the Vietnamese community and hog processing workers from the Eritrean and Chinese communities, also in Westman. And that led to a couple of years ago, we did some research using Dr. Rob Chase's life storyboard and compiled with those interviews, compiled a report that's called Stories of Newcomer Workers in Manitoba's Food Processing Industry. And that makes recommendations to a number of different organizations that have responsibility for workers' health in that industry. So that is also available on our website, and it's something we feel pretty proud about and still very relevant, particularly in these times we're in right now. We've also over the years had been engaged and giving ongoing support to migrant workers through grassroots community organizations. So this isn't really funded by any outside funding organizations. The OHC devotes our staff time to do this work. We did have some funding through Workers' Compensation Board to work with temporary foreign workers in the food processing industry as well. And currently, this is an exciting new project, but very challenging during the pandemic as well, is our Healthy Nail Salon Worker project with the Vietnamese community that we're currently engaged in. So all of this came about from that initial work that we did developing relationships with newcomer communities over the years. When the COVID-19 pandemic hit, I know this is like the big thing that we're all dealing with right now. It really, though, to us demonstrated that this community development approach that we've taken with newcomer communities and that we've engaged in with newcomer communities has really been very important. And it's really a testament to this kind of approach. It allowed us to quickly connect to a network of community trainers that are working with us. We provided very quickly a series of online presentations around accessing CERB, around workers' health during COVID-19, around right to refuse, what that means, and how to use it in these times. And community trainers connected to their own community members with really important and timely health information during the public health crisis. We also developed and translated multilingual resources on workers' health during COVID-19, and Dorothy Wigmore, who's going to be presenting soon, helped us do that research and development. And this isn't just the basic information about COVID-19 that's available from, World Health Organization or from Manitoba Health. This is really geared to what workers need to do to and what workplaces need to do to take care of their health within the workplace. So it is specialized information for workers about the risk of the virus in their workplaces and how to prevent transmission. And so currently right now we're assisting community trainers deliver online workshops that include information about the pandemic, but also still grounded in information around workers' health and safety rights in general, because they are very connected. So it is 2020, it's our 20th anniversary. And so just as I leave this off to other folks, I do want to say thank you to all of OHC's community trainers and cross-cultural community advisory committee members. It's often said we couldn't do this work without you. And in this case, it's absolutely so true. None of this work would be possible without them. I did specifically want to mention some of our founding members of our cross-cultural community advisory committee that still are with us. So Tej Baines, Jose Chinchilla, Marta Chicas, Kwan Hai Tontat, and Van Nguyen have all been with us for many years of these 20 years. I also too want to acknowledge it's not just me working on this from the OHC. I have a co-worker, Geeta Jaya Singh, who's also here in the audience, and she's been working very hard on this program for the last 12 years as well, and I couldn't do the work without her either. We were really excited when Dorothy Wigmore approached us about a research idea connected to this program. We've been working so hard for so many years trying to develop programming that, you know, we have a lot of our information in different reports and it's spread out everywhere. And so when people ask us about the program, it's hard to, you know, give them a succinct document. And so Dorothy went above and beyond and did a lot of research, looked at all of our reports, and gathered it all into this report that we're so excited to be here with her today to launch. So it's a very useful document for us, and I hope for others in the community too who may be able to learn from our model and from what we've been able to accomplish over 20 years. I do also want to really thank CCPA Manitoba and through the Manitoba Research Alliance for providing the funding for this research and the report today. So that's it for me.
Thank you so much, Karen Hamilton, who's a program coordinator with the Occupational Health Centre, for that presentation, and to Marta Chicas for your presentation. And now we have Arek Manyang, who's a community trainer from the Sudanese community, and she's here to give the trainer's perspective. Welcome. Over to you.
Thank you. Thank you, Molly. And thank you, Karen's and everybody at OHC. Thank you for having me. I just want to say first, happy 20-year anniversary to OHC. It's amazing, 20 years. We came in the middle and we are here. So I'm here tonight to speak about my experience as a community trainer from my community. I started way back before 2011, before the country was divided. It used to be all Sudan. And then by 2011, the country has divided to be Sudan and South Sudan. But we still do the training for the both country together. We collaborate together from the community of Sudan and the community from South Sudanese together. We do that. So I've been with the community trainer for a while, and I was one of the trainees, and then I become the one of the community advisors. So my experience with OHC and the community is that the community trainers, they are the connection between the two, between OHC and then the community, to find the people, suitable people who can attend the training and then come and be trained. And those people, they usually go back, but mostly usually are the leaders in the community, because those people, they will go back and train the communities. And it's easy when you have the leader from the community who are already involved in the community. It's easy to find people to do the training. That's one of the things that I have experienced, and myself doing that with other people from my community. It works so well because leaders will always see something positive and they bring it to their community to go. So OAC has been really doing well in most of the community through the community leaders. And then also what the impact that I have seen in the community through this training is that most of people who are newcomers to the country, they struggle with a lot of things when they come to the country. And I remember when I came in late 90s, there were not a lot of the program for the newcomers. But those who came after year 2000, there were a lot of program. And one of them is this OHC has provided this. One of the problem that the newcomers struggle with is knowing their rights at work. You come as a newcomer, you get a job, you gotta work, and when you get hurt, you don't know where to go to. Sometimes you might have been trained, but sometimes you don't remember when the time comes. And what the OHC help is that you give the training to the newcomers in their own language where they are comfortable to speak up and can ask their question in their own language. And it helped. I have seen in my own community that people, especially knowing your rights at work, right to know, right to refuse unsafe work for you. It was a little bit challenging for most of people, but when they got the training and they know, they were able to speak up about what kind of work that they can do because of it's not safe for them. And that's it came from the training that they got. And I really see the impact, and people have come up and they speak up when they got hurt and they know where to go to WFC. And those kind of things, they're very helpful. So with me, somebody been doing that for a long time, I'm hoping that the training can continue to reach so many newcomers for many years to come. And so I just want to say thank you. And if anybody have a question, you could please go ahead. Thank you.
Great, thank you so much for that presentation. It sounds, yeah, like you've had lots of experience, and we look forward to, we're going to take questions at the very end, but I'm glad you'll be here for questions for you, Arek. So thank you so much. And now it's my pleasure to introduce Dorothy Wigmore, the report author. And here is the report in paper form. It's also, we'll put the link to it at the end of her presentation in the chat here. Dorothy Wigmore is a longtime occupational health and safety specialist based in Winnipeg with a training in occupational hygiene, ergonomics, and work organization stress. She has been a practitioner, educator, researcher, and writer in Canada, the United States, and Mozambique. The MFL Occupational Health Centre's first occupational hygienist. She has worked with and for governments, unions, NGOs, and universities. So over to you, Dorothy.
Thanks, Molly. Pleased to be here. I'm going to do the proverbial share my screen. I will try not to screw this up. We'll just see how it goes. Hang on a second here. Okay. All set? That works? Great. So I'm going to try the very difficult task of summarizing what's in these almost 100 pages of a two-part report that we're calling Communities Are Partners, as Karen and Martha showed in their presentation. I'm going to talk about some of the findings and recommendations, but know that there's much more to it than I've been able to put together here. And just so you know, the picture here is from one of the picnics that the program has had in the past on an annual basis to recognize the trainers and the advisory committee. So I want to just be clear at the beginning that migrant's a general term that doesn't distinguish the status of people who come to Canada. And for the Occupational Health Centre, or OHC, they use the term newcomers to mean permanent residents, refugees, refugee claimants, migrant workers, temporary foreign workers. There's students, there's folks without documents, a wide variety of folks. And the federal government restricts funding to programs for permanent residents and refugees. So even though newcomers includes a whole lot more people, the feds are very particular about who their programs can fund and what they can support. So OHC has used other funding sources to do this work. And so in the report, I use the OHC definition and sort of alternate between newcomer and migrant to emphasize that. So just so you know, there are two parts to this. I got a little carried away and did essentially what became a background paper that covers occupational health, the sort of approaches to it, some stuff about community development, and some of the statistics around newcomers, migrants in Manitoba and Winnipeg, and the languages they speak and things like that. The other document, which is about 50 pages, is the report itself, which has a bit of that background in it and is based on looking, as Karen said, at a variety of documents that the OHC already had, as well as conversations with her and Gita and focus groups with some of the trainers. So just in terms of a little bit of background, I want to be sure that people who may not be familiar with health and safety know that it's considered to be a human right by the UN. It is a public health issue, which makes prevention the main goal. It's not just a technical or legal or economic issue, or as the Italian workers model says, our health is not for sale. One of the interesting things I discovered is people talk about health and safety being a social determinant of health, and others are talking about corporate and commercial determinants of health and how work fits into that. It's about power and democracy, as Bob Sass, an important person in Canadian health and safety legislation and activities, says. And I always try to remember Irving Selikoff's phrase that the statistics that we talk about with health and safety, the toll, are people with the tears wiped away. So what does this mean for newcomers? The folks at Ryerson who do work with a lot of migrant workers, Winnie Ng and others, produced a report with a graphic in it that I borrowed that talks a lot about both physical aches and pains, and you can see there are a lot of them as well as mental health ones. So what it means is that newcomers are vulnerable for all kinds of systemic reasons and because of job situations, and they tend to be more women and racialized people. They're often working in non-unionized, physically demanding, precarious jobs, small workplaces, somewhat like Indigenous workers. They're more likely to be injured, especially if they're temporary workers. Their reporting injuries are difficult for them for financial reasons, job consequences, they're unclear about their rights, and the systems really don't help them very much either. Language issues, of course, affect knowing and using your rights, training, getting a good job, those kinds of things. There are mismatches between jobs and education, as the literature says, as studies say. Women tend to be worse off than men. And as some of the folks at the Institute for Work and Health say, when you add all this up with a power differential, you have a perfect storm and toll that is underestimated. One response, speaking of the Institute for Work and Health, is something called an Occupational Health and Safety Vulnerability Measure. And the researchers at the Institute developed this. It was to identify and improve conditions for newcomers. It includes a survey, and the link to it is there. Vulnerability they define as exposure to hazards without protection. And they say that there are 4 things that matter. There's the hazards, including harassment or bullying, and they can be combined with inadequate policies and procedures that are supposed to fix things and prevent hazards, lack of worker awareness about the hazards and their rights, and or worker, what they call empowerment to protect themselves, to speak up and refuse, that kind of thing. So the document contains, I don't know, 10 or 15 pages of the history, both as a sort of a graphic form, not a graphic, but along the bottom, a timeline, as we're showing here, as well as a discussion of some of the things that Karen mentioned and some of the more detail. When I started to think about community development, I came across this ladder of citizen participation by a woman called Sherry Arnstein that goes back to the 60s, actually. And it's really important both for health and safety and for whether it's around migrant issues and community development. And there are various, as we know from joint health and safety committees, there's sort of the pseudo or informing consultation, but when we're talking about real citizen power and real community development, we're talking about people having control of things. So Karen was saying that lots of organizations are reluctant to use a train the trainer program, which is common in good community development. We're different, she said, because it works, it's effective, and we put resources into it. And the advisory committee makes us accountable. They're invested in it, and they expect that commitment from the OHC. My friend Sherry Barron has done work around the same kind of thing, and she talks about this community-based participatory approach is useful to reach low-income workers, especially if they're dealing with health and safety. It's effective in developing education and outreach programs to overcome various barriers, and it builds local knowledge and leadership to create sustainable programs. I want to be clear, though, that it's more than cultural community members delivering first language workshops. And just to quote from the report, by definition, effective community development expands the ability of communities without power to influence and participate in decisions affecting them. And what really was clear from the work is how this is working, and particularly how the advisory committee members own the program, are loyal to it, and the staff that are involved. And at the same time, they're deeply discouraged by the OHC board's decision to reduce their representation and lack of follow-up to their policy proposal they made in 2007. And as I point out, there's a parallel within health and safety that's political. There's underlying issues around workplace democracy, who has the right to say what and when. And studies show that when you have high levels of control, i.e. power, participation, and respect, it's key to healthier and safer workers. So consistent themes from the evaluations of long ago, as well as modern the focus groups I did, is that the program is a success in many ways because of this model, because of the different things that go into it. The using the first languages, like these Punjabi folks and trainers from the community, leads to fuller discussions, experiences being shared, questions, etc. The approach contributes to the trainer's commitment, learning ideas for improvement, and it helps them to be, and the participants to be more confident to speak up or to assert their health and safety or workers' compensation rights. Knowing more about health and safety and workers' comp makes a difference. It's obvious. The newcomers and their communities actually recruit others and spread the word. There were 3 videos made, like this Ethiopian Eritrean one. It's clear that incentives help recruit participants, And food is an essential part of many communities' gatherings. The successes include the trainers are seen as knowledgeable and credible sources in their communities, and people come to them for help. And first language delivery is essential. So one trainer talked about, I like the fact it's given in first language to people in the community because folks don't understand English, especially if they work in factories. They haven't had an opportunity to go and learn and improve. So they understand it's way easier than to learn it in English. They get involved because they care about communities and the topics and wanted to learn. And somebody talked about working in a factory and getting hurt a lot, didn't know she had a lot of rights. When this opportunity came, it was perfect for me, not for me personally, but for me to teach others how to take care of themselves when they're at work, especially in a factory job, which is most of the newcomers. And another person talked about how heartbreaking it is that people get injured at work and end up make the decision to go empty-handed and be sick back home, and not get comp of any sort. And she talked about how she came from a country without a union, didn't know what that was. Somebody had to tell her, and that for those who are new, they don't know the system, they don't know how it works. And this is a golden opportunity to pass along information. In terms of finding out about this stuff, the education is important, but not just the content. Sorry, I can't see my, okay. The training was an eye-opener for me as someone who used to clean with chemical cleaning products. Most employers, they don't take the step to explain to the new immigrant, that's what you're supposed to know about. It was good for me to learn and pass the information along. It helped me personally, and was good for me to help others. And the trainers feel committed and rewarded. And so this example of this person was telling a story about people who come to a workshop, heard about somebody running into difficulties at their job, went to her, gave her a bunch of information. They helped the lady to get help. So when we had the workshop, they talked about how she got help. They were appreciating our program, saying this program helped the lady. Everybody's learning, capacity building is happening. And this person talked about how rewarding it is to know that people are learning and listening and appreciating things. And there was this story in the one of the evaluations about a woman called Saba who had finally stood up after many issues at work. And it turned out in the end, and essentially sort of got fired. The employer changed her story, took her back, relocated her to avoid the conflict. Saba says she has no problems at work now. In fact, she reports that her employer is now afraid of her because she spoke up. For 8 years, she worked without saying anything, but now she knows her rights and is not afraid to speak up, and the employer treats her with more respect. She also informs others in the community who are planning to take a job with the company about what to expect and how important it is to speak up. So it's not all rosy. There are challenges. Those permanent resident rules that the feds have make it hard to recruit when people need to work. They want to improve their English first, and various people get excluded. Childcare has been an issue. It's difficult to arrange, and in fact, I don't think is supported these days, except maybe through some creative measures. Incentives are needed. Recruiting or finding locations can be difficult. Remember, there's only sort of people getting paid for 10 hours total. There are a bunch of other reasons, with everything from political divisions, people needing refreshers. It's hard to convince folks they won't be fired if they refuse. And quite frankly, I think the elephant in the room is the employers aren't obeying the law, and it's understandable that newcomers fear losing their jobs if they speak up. So one of the trainers talked about how many participants end up being disappointed when they get information that they want to practice it, at least in the chicken factories or other factories, they're not allowed their rights. When they get injured or health problems, there's no policy to protect them. So the employers are not following procedures, they're not listening. So what's to be done? I've got a series of, I think it's 15 recommendations, and I'm going to sort of, there's a lot more behind them than and I've tried to sort of quote directly from the report, but sometimes I had to squish things to make things fit. So the first recommendation is that the advisory committee, the program staff, and the Occupational Health Centre compile and review the detail of all past evaluations and suggest the stuff in this report to look at what could be done, set priorities. And I know that is going to require some funding rules to change. I think it's also important that they send this report off to the provincial government with a briefing note pointing out the recommendations that are relevant. And I think there are these important questions to ask, like what are employers doing, and what about provincial enforcement, and what would life be like for migrant workers if both did their jobs? There are also recommendations about the Workplace Safety and Health Act and things that need to change in it. And I think it should explicitly say that employers must display an approved poster about their duties and workers' rights. That's what happens in the States. Workers need written and oral information in appropriate languages. And the training has to be effective, ensuring that workers understand. That's the way it works in the States, for example. The Workers' Compensation Act needs to make similar provisions in its rules and processes. And I'm suggesting that the Workplace Safety and Health Division, or branch as it's called these days, Safe Work Manitoba, the WCB, and the Worker Advisor Office work with the Institute for Work and Health to figure out how to use this vulnerability measure in consultation with the folks in the program, and involving other government departments, the Federation of Labor and unions. Then recommendation 5 is that the Workplace Safety and Health Branch should ensure that SHOs, the safety and health officers or inspectors, either speak relevant languages when they go out or arrange for an independent interpretation while maintaining confidentiality. And they have to think about it in terms of their answering machines and recorded messages and stuff like that. The branch also should really be prioritizing enforcement, focusing on sectors where newcomers are typically employed, and paying attention to these requirements about orientation. You know, there's all these things that are supposed to happen when new workers, and there's a definition of that, start a job, start a new tasks, those kinds of things. And not the branch shouldn't just be looking at so-called high hazard sectors or workplaces. They need to increase inspections and enforcement campaigns where vulnerable female newcomers are concentrated. And there's been some really valuable research around that. And they need to make it clear that the rules apply to all workers and to all employers, regardless of workers' legal status. Safe Work Manitoba is the information arm around health and safety. And I think they really need to have some kind of champion within the organization to coordinate programming for newcomers in partnership with this program and a variety of others. They need to develop a campaign like The Work Shouldn't Hurt that is about vulnerable workers informed by various things, and provide training and resources to employers who hire newcomers with a focus on small businesses, especially the ones that are owned or operated by newcomers, to ensure they actually know what they're doing and have resources to carry them out. I actually counted up the number of languages in which they produce materials, and they're totally ignoring the immigration patterns in the province. And they don't do a very good job, I think, of distributing them. And if you wanted to find multilingual resources on their website, you have to go down to the very bottom where they are listed. It's almost impossible to read. It's just really difficult to find them. So for the Workers' Comp Board, there's a variety of things for them that have to do with interpretation and keeping track of things, and language, and protecting workers who file claims. The provincial government, I know it's not necessarily worker friendly, but I think there are things that they should be doing. They really need to be integrating their multilingual, multicultural approaches into all the activities that involve newcomers. They need to make sure that workplace rights awareness are part of the programs that newcomers get, and fund folks that are going to help with that. The Worker Advisor Office needs to be doing more and funded to do that. And there's a bunch of government agencies and departments that deal with job-related issues. They need to be providing easily accessible information and services in multiple languages with culturally appropriate materials. And they need some education, cultural competency, anti-oppression, and human rights training for all folks in those kinds of agencies and departments. And then the various, the board, the Workplace Safety and Health, and the Advisor Office should be collaborating to ensure that their policies, procedures, and systems ensure that reprisal complaints from migrant workers who may be repatriated are heard and decided before that's likely to happen. And there's some documentation about this. The provincial government also should look at all the mechanisms at its disposal for things related to funding, working with the feds, and sustainably funding health authorities and community organizations, et cetera, supporting collective community-based networks for all migrant workers to share information and look at new issues. When it comes to the feds, they really need to keep funding and supporting this programs, letting it expand and continue its work. Allow projects to actually give incentives and cover food for participants. Funds for childcare or more flexible requirements for community-based activities. Make it easier for agencies to cooperate around childcare, and support activities that allow the staff, the trainers, and the board, advisory board to meet, share, evaluate, and plan things. The feds also should be providing information about employment standards, health and safety, and workers' comp, and materials provided to newcomers before they get here or soon thereafter. And change the rules so that everybody who is considered to be a migrant, or the OHC's definition of newcomer, can be included in programs like this. They have to insist that newcomer programs they establish, operate, or fund include workers' rights training done by independent nonprofits in first languages. Use the program folks or people trained by them. And there is this Canadian Immigrant Settlement Sector Alliance that needs increased support. In terms of the settlement organizations, I think their staff really needs to know a bit more about basic employment standards, health and safety, and workers' comp. It should be working with folks in the program to integrate that information into the work they're doing. Regularly use the trainers to provide first language workshops, which has been done in the past, with specific information. So folks are getting accurate answers to their questions without worrying about losing their jobs. Their staff really need to be trained about how their programming can reinforce cultural and gender stereotypes. And this is where some work by folks in Toronto, and Winnie Ng in particular, was really informative. That women from all cultures need access to the same employment programs as men, regardless of background, and not assuming that women are just going to do female-dominated jobs, or that they're less hazardous than male-dominated ones. And they need to be following up on job placements to make sure that find out more about the working conditions and health and safety training and workers' comp, and help people report illegal practices. And they need to recognize the differences between immigrants and refugees, especially for women, with specialized job services, that not homogenize programming for everybody. And of course, that they need appropriate budgets. So finally, this program is a unique and important project with a long history within the Occupational Health Centre, which is an important occupational institution in itself. And I think that the center and the program folks should build into their work plans doing outreach with settlement organizations and a variety of other unions and community health centers and other allies about providing workshops and offering programs about basic rights. On an ongoing basis, I think that the OHC and the advisory committee need facilitated conversations to support, it should say, the CDC, the program's activities, learned about its successes and deal with its challenges. And the OHC and the program folks and the advisory committee should ensure that the advisory committee members and staff working with them continue their collaborative efforts to advocate for and influence government policies, laws, programs that affect newcomer health in a systemic way. Finally, a blue sky, and it was a pre-pandemic idea. So the last recommendation was relatively soon, so we'll forget about that part of it, but that the OHC, the program folks and others should organize a gathering of those working with migrants in Manitoba, folks who are interested in worker health and safety, and others interested in the field or topic to raise the OHC and programs profile and look for collaborations to provide long-term sustainability for the programs and others like it. I provide a bunch of ideas in the document, but talk about people who from provincial and federal governments, settlement agencies should be included, unions representing migrant workers in particular. The Alberta Workers Health Centre had a similar project that is important to learn about. And Jared, unfortunately, has a sewer backup tonight, so he's not here to tell us more about it. The Occupational Health Clinics for Ontario Workers has a migrant workers program project, and something called Stress Assess, which might be really interesting to use in terms of newcomer health and safety. There are a bunch of academics that have been looking at this, and the Institute for Work and Health Researchers. So a lot of recommendations, a lot of things, some of them probably a little pie in the sky, but that's what they are. Finally, many thanks to the program staff, the advisory committee and trainers and others who helped me prepare this. I've learned a lot. And thanks to CCPA for the funding and Jim Silver for the conversation that led to it. I will stop sharing.
Thank you so much, Dorothy, for that incredible presentation. All of those recommendations are so thorough, and for sharing your expertise. I like how you connected the theory to the practice and the literature as well. That was really wonderful. And I just love seeing photos of people together without masks close together. It's just so wonderful. We will get back to that point, hopefully sooner rather than later. So yeah, thank you so much to all of our panelists. We do have some time for questions and discussion. So feel free to put that in the chat, or raise your hand if you'd like to ask a question over your computer out loud. Oh, we do have one. I think I see Joseph Coffert asking a question here. So we have Andre is our tech wizard. So can we hand that over to Joseph to ask that question?
Hi. Thanks very much, Dorothy, and to all of you, and for the report. And I've actually looked through it. I've taught at the med school for years and had both the workers part through Robbie Chase and many of you, but also had the language translation issue. And I think it's an important document because it brings the two initiatives together. And I find the context in terms of Dorothy providing the history and a lot of the models, which most reports don't do, really important. I think one of the challenges, and I know, Martha, some of the work that you did in language translation and reproductive health had to do with how hard it is to take a concept like the right to refuse, which medical students would be taught as autonomy, and translate that into the real right to say no with industrial workers. And I can remember in the early days of the program with the abattoir workers in Brandon, that idea that they were told that they had the right to refuse, but it needs to go broader from a community perspective and actually an entitlement perspective, that no really can mean no, and that the worker perspective within the union and the individual rights perspective can sustain them. And I think it's really important in a COVID era where a lot of those initiatives were people in standard industrial language settings. But if you think about it now, my own involvement recently has been with personal care workers working in the community, many of whom are immigrants and refugees. And that right to refuse work is such a central situation within the work that we're dealing with right now. Those workers who are really the front line and the highest risk individuals, and yet they don't fit within our traditional industrial language training. And I think if there was a point where this program could reach even a broader range of workers, it would be with those frontline workers where the right not to consent or the right to say no in terms of dangerous work is really a fundamental issue in terms of what we do during and after COVID.
And one of the things, Martha, I know you're taking notes there and you want to respond. And one of the things to just add a tiny bit to Joe's point is that the right to refuse dangerous work, it's not unsafe work. In this province, it's the right to refuse dangerous work that may harm you or someone else. And it's quite broad, and we have many more possibilities for creative use of that here than people do in some other jurisdictions. And so translating those broad, that creative use of something as fundamental as saying, this is going to harm me or harm someone else, I don't want to do it, I think is definitely is a challenge. Martha, you looked like you were scribbling away there.
Yes, I was taking some comments, some notes when I was hearing Joe talking. Yeah, and thank you for bringing that out. I know in our work, when we do have done translation material, it is very important to really provide those resources to people, have them at hand, because you see, first language is the language of the heart. If a lot of people are very vulnerable, they're also worried about losing their jobs, and we come from different communities where rights has been violated, the widest level. So it takes some time for really encouraging people and empower them. But if we provide resources in first language, and that is a first step. And also throughout, the way, encouraging and provide more and more information. And also it is great because, the trainers in this program, those are people also working within the same sectors. So they also have experienced the same challenges and issues, and they now are more informed. They have more experience. So it is a take and give relationship. And that's actually this title and that quote for one of the advisory committees, the communities that partner is really a great, reflects this work. And I was also thinking that, in terms of the first line workers, the health workers, I think, this report and the work that is done could also be provided to the unions, the association per se, because sometimes the unions, the shop stewards or the people who work in the floors are also the same immigrants with the same challenges and with the same fears and issues. So it started from the top, so people could encourage that, to create that change.
Thanks, Marta, and thanks for that comment and question, Joseph. Arek, I know you have to leave right at 8. Do you have any comments or parting thoughts for us about?
I just want to add about the right to refuse thing. In my years of training, there are 4 rights to know. But one of these right to refuse, it always grabbed attention from the participant in the training. Because most of people, like Martha said, they came from a country where there is no union. And so union is the one who protect your rights, but they don't have that, many of them. And then when you get a job, you hold on to it because you don't want to lose it, because it's the one providing for your family, not only here, but also back home. So if you lose that job, it's not easy to get another one so soon. So you hold on, even if you don't, you think that job is unsafe for you. But when you are aware, or you are being educated, this is your right, and you're not going to lose your job because you do have to speak up for your own rights, it gives them power and empower them, the new participant. And so they can speak up and they can say when the job is unsafe for them. And that's the only right I see always grab attention of the people, the right to refuse unsafe job. So that's what I just want to add. It's very powerful one. It's sometimes you don't know until someone really, someone speak up about it, how it affect them, or how impact that have done in their work life. Thank you.
Yeah, thank you. That's a very good
One
point.
thing that was apparent to me in talking to folks like Arek is that it's not that people go out and use this, what they learn right away, that it's, you know, there are opportunities and people pick and choose when they can, you know, it's best for them to use these rights. But the fact that they know about them and they hear stories about other people who have used them, I think is really important. And it expands. There's Karen was telling me when I interviewed her for the report about how it's sort of given people the confidence. Going through this program has given people the confidence to do things outside their workplaces or to other parts of their workplace. So it's not just that the results show up in terms of health and safety or workers' compensation, but they show up in terms of community involvement, of people standing up around other things as well, and feeling more confident to do that because they understand, you know, they do have rights, and, you know, maybe if I've got a right here, I've got a right there, and why not stand up and say something?
Yeah, that's great. The ripple effects. We have one question. We're just at our time, but I'll make
Somebody wants to sign up.
oh, there we go. Yeah.
Talk to-
We have Monica, who's got a question here, and we've given the mic over to her. So please, Monica, go ahead.
Not a question, actually. I wanted to make a positive comment about it. When I did one program in my community, there was a participant who works in a cleaning industry. And, you know, with the chemicals which are hazardous, there are a poster hanged where commonly people can see it. It's always in English, but the newcomer, they have difficulty in the English language. And I can share, she happens to be using Bengali, one of the East Indian languages. So she said, I was unable to read what is there. Well, how can I take precaution from them? She came to me and they asked me to translate, and the employer provided her the translated transcript of the hazardous use of hazardous material. If you come in contact, what are the precautions you have immediately take? So that was a positive note I wanted to share.
Well, thank you for that. Well, yeah, I think we're just a little bit over our time. We gave an hour for this, and we want to respect people's time. So thank you so much to all of our attendees for participating here. This is recorded, and we will make it available online, and we'll send you an email give us about a week or so, and we'll tell you where it is online so you can refer it other people to this recording, this presentation. Thank you so much to Marta, to Karen, to Arek, to Dorothy, in particular for all your work on this and for all of the work that you do generally. Andre Forrest is the coordinator with the Manitoba Research Alliance, and she's pointed out to me that it's just so wonderful to celebrate a success, particularly right now when we're all going through so many challenges, some communities more than others, notably with COVID. And I Can only imagine what newcomer vulnerable communities are going through right now with fear of losing work or being out of work even. So it is good to have this positive report right now, but still obviously much more work to be done. So thank you so much for those recommendations, Dorothy. And I should note, I think it's okay to share that Dorothy is got an opportunity to live elsewhere. So she'll be leaving our beautiful province. So we're just so lucky that you're able to give us this wonderful resource now. And I know you'll be still active in many ways, but from a different spot in Canada.
Yes, thanks. And, you know, partly because of the pandemic, it's more meetings like this. It doesn't matter whether I'm here in Winnipeg or in Kitchener in my new apartment.
There we go. Yeah.
Thanks
Yeah,
to everybody.
Close if we're not physically in the same place. So yeah. Well, thanks so much, everyone. Have a wonderful evening, and hopefully we'll see you sooner rather than later. Thanks.
Thanks, Molly. Thanks, everyone.
Thank you.
Thank you.
Thank you.